why that never happened. Initially, it was PHAC that took the lead on this. So why would they not have been driving the ship on this?
So the Auditor General has pointed to the necessity of having this kind of specific governance in place, and I would say that a letter of intent was established when the app was required to be mandatory in July 2021. Initially, we were working in close collaboration with the Canadian Border Service Agency at high speed, and at the time, a decision was not taken to slow that down to put in place the governance around it. That is something that we very much regret and have corrected for our future pandemic preparedness and response. It is very important to ensure that the responsibilities, accountabilities are itemized very clearly, precisely to prevent the kind of situation that the Auditor General has pointed out, where each department I think assumed that the other was taking some of this governance and putting it in place. The Canadian Border Service Agency was responsible for the development of the app, and the Public Health Agency of Canada was working to establish the public health measures and guidance and border operations that need to be put in place, and the other corresponding policy, legal, privacy, and other structures around the app's deployment. So while there was a de facto division of labor, that was not codified, and that is something that we have now corrected going forward.
So has PHAC ever had to turn around a project as quickly as they did with the ArriveCAN app when going from manual to digital base? And how long would such a transition normally be expected to take?
So the Public Health Agency has never had to undertake operations of this nature, including at the border. The pandemic required that response. I can't say exactly how long it would take, but there is very detailed and sequential governance around the development of IT projects, and it would normally take years potentially to implement longer-term projects. In this case, they were undertaken on an emergency basis, but there still should have been documentation around that. But the reason that it went forward so quickly was because some of those processes were relaxed given the emergency nature of the deliverables.
So now to Ms. Hogan, has the major problem that you've encountered in this report around the area of lax bookkeeping and record-keeping practices in terms of the ArriveCAN app been of a similar instance in any previous reports that you've conducted? Have you encountered this laxness in any other reports?
Well, definitely my office has seen some similar failures in lack of a governance structure or accurate and timely information. I think it's easy to point to the Phoenix-based system as an example of that. But when it comes to, I think, failures at so many different layers, this is the first time that I have definitely seen this. I think it's more than contracting. It was contracting. It was project management. It was IT management. It was bookkeeping. So, I mean, there were so many layers here. I guess the last comment I would make is that it's very common when we look at horizontal projects, when more than one department is involved, to see that the clarity of roles and responsibilities is often a contributing factor, or the lack of that clarity, I should say, is often a contributing factor to why certain horizontal initiatives are not well managed or delivered. So, I would point those to some of the similarities.
And do you believe that the poor bookkeeping and records stemmed from a lack of internal knowledge surrounding the project, or from the high use of external contractors? I agree with the number of departments involved. That definitely complicates everything, for sure.
I mean, in this instance, if you're talking about the record keeping, I think it was the fact that, many individuals, didn't seek, they had many opportunities to seek extra clarity and specificity, whether it be in a contract, in a task authorization, in reviewing an invoice, or the timesheets that went with it. So I think there are many instances when clarity could have been sought, which would have improved record keeping. When it comes to the other aspects, I think it speaks to the need to make it clear at the outset who's going to do what, so that you have clarity around who's going to be accountable for certain steps whether they should be taken or not taken, and more importantly, accountable when it's all said and done to Canadians.
And that is the time, Ms. Bradford. Maintenant, Madame Secrétaire Desgagnés, 2 minutes 30 secondes, s'il vous plaît.
Ms. Secrétaire Desgagnés, 2 minutes 30 seconds. I'm back with the Auditor General. At the beginning of your report, and I would like to quote you, the agency had the functional responsibility to implement ArriveCAN till April 2022. So PHAC was aware of the fact that there were lots of contracts awarded, and they had to know that contracts had been awarded. Did you find any documentation to highlight the fact that they were aware, for example, that GC Strategies had received about 130 contracts? Did you find any evidence on that? I think you've kind of broadened the question. Contracts awarded to a vendor that did not have anything to ArriveCAN. Well, on that, I don't have any comments. It was clear that at the beginning of the pandemic, the Public Health Agency of Canada had a lot to deal with. So the agency was very small in the past at that time. So they had to seek help from CBSA. And they asked for help for the agency. Asking for help to develop and implement an agency is not proper oversight. So we don't have any documentation. So there was no documentation, no oversight. I know you stated that there was no budget, no timetable, no deadlines, no basic control processes. You have no evidence, for example, and you talked about communication between PSPC and CBSC when it comes to the non-competitive process and so on. Were they the same exchanges when it comes to the scope of the non-competitive process? Was there any information whatsoever on PHAC? There were lots of committees that were in discussion, but as the president testified, they were talking more about health issues. Discussions that were necessary was not about oversight of the project or deadlines or cost. So even though they were responsible for oversight, they were neither responsible for the budget, processes, timetables, or how the taxpayers' money had to be used. They had no concern to find out that kind of information. Maybe there was the concern about that, but there was no trace for any auditor to be able to check. I'm sorry. You'll have another turn.
The floor for 2.5 minutes, please.
Thank you very much, Mr. Chair. I want to turn again to the report, page 15 in the English version under findings related to no governance structure or budget. The narrative we've heard so far, and the one we've been investigating from the Auditor General, which we thank for her work, is the fact that on the onset of the development of ArriveCAN, we've seen that there was no formal agreement existed between the Public Health Agency of Canada and the Canada Border Service Agency on their respective roles and responsibilities. We find that those roles and responsibilities are critically important because they delineate, of course, things like the project objectives, project goals, project budgets and cost estimates, assessment of resource need, and even risk management activities. This could have been avoided should there have been a good governance structure, at least to have given red flags to this. The president of the Public Health Agency, you mentioned that there was weekly meetings to establish work on ArriveCAN, but it failed to accommodate for any of these really important governance issues. What was discussed, if you can, in just maybe 15 seconds in those meetings?
So at the meetings, my understanding is the focus was on how to operationalize the OICs at the border through the app. So they would go through the different releases. They would look at readiness checklists for the releases. There was a formal intake process for any changes that would be made to the app and documentation of the business requirements for each change. So there was a lot of discussion around the operational rollout of the app and its different versions and adjustments. But what the Auditor General has pointed to is that the overarching project governance infrastructure was not in place or documented.
I thank you for that statement, because it seems as though that was known to the ministry, or sorry, to the department. Then a letter of intent was established between the agencies, and you mentioned that, to sign on July 2020 and was in effect till March 2022. The letter then clarifies the things that should have been done largely throughout those meetings. And so I was pleased to see at one point there was a check and balance. We then find non-competitive contracts, however, are then distributed. It is a shame that upon the time that this was caught as an issue, that we almost see this burying of the facts by the release and tenureship of a competitive contract, but your agency was directly involved in ensuring that the experience and qualification requirements of those contracts were very narrow. How is it that that's fair for Canadians when so many times we see the abuse of these kinds of instances take place, and we had an opportunity to rectify that by a competitive process, but then we've seen the terrible issue of ensuring that your department...
Mr. Desjardins, you're out of time. I'm going to allow for a response, though. Mr. Desjardins, you're out of time, but I will allow for a response, please.
The decision was taken to enter into a sole source contract with KPMG because of the time pressures of needing to put in place the actual rollout in the airport processes, the need to liaise with airlines and airport authorities, and the need to ensure that the traveler journey and the information that was being put out to the public about the app was accurate and timely. So the sole source was pursued for reasons of speed of response, and the reasons for choosing KPMG were documented. However, the Auditor General has pointed the need for more documentation in that regard, and so I would say the subsequent contracts also stemmed from the experience and track record of excellent delivery of the vendor on those services.
Thank you very much. Mr. Scheer, welcome. Thank you for joining us today. You have the floor for 5 minutes, please.
Thank you very much. Question for Ms. Jeffrey. You indicated that of the 177 updates to the app, that proper testing for the updates wasn't done. Do you believe that's acceptable to operate in that manner?
A best practice would be to test all of the different applications. However, my understanding is a decision was taken to only test a sampling of them because of the time that it took to test those and the pressure to have the adjustments rolled out quickly.
Okay. Who made that decision?
I don't know who made that decision at the time, but
Well, who has the authority to make that decision? Decisions don't just get made; they don't just appear. Who would normally have the authority to make that decision?
The app development and rollout at that stage was being managed by the Canadian Border Services Agency, and the Public Health Agency was collaborating with them in terms of...
Okay, so are you saying it was somebody at CBSA that would have made that decision? Or someone at...
I believe that CBSA has already addressed this in their previous testimony at this committee.
So was it somebody in your department that made the decision to not test the apps?
I'm going to turn to Luc Brisbois from the Border Services Branch.
Yeah, I think the President's right in the context that the governance would have been the place where these issues were discussed, but from an IT perspective...
Nobody knows. We have all these officials who make decisions that impact people's lives, and nobody knows who makes decisions when the government's going to relax.
I think for the Public Health Agency, the key issue was the dependency on the implementation of the OIC. So things had to be decided, and in the context of this...
Every department has an org chart with
been
titles and with names. There's a lot of words going on, but like, who normally has the authority to decide to relax rules or processes?
With respect to the testing or the contracting?
The testing.
Yeah, the testing, we were providing CBSA with the advice of what we needed in the application, and they were running the process.
Okay, so who would have the authority to suspend normal processes or relax rules?
I think it would have been done through the governance of the DGs and the ADMs at the time. We'd have to go back and take a look.
Okay, I'll move on. The 10,000 erroneous quarantine orders, was that a specific event? Like, was there one glitch that created all of that, or was that cumulatively over time, 10,000 wrongful quarantine notices were given out?
So that was a specific event that was identified on the 28th of June and resolved on the 20th of July. So it was a specific event in the app, an error that was identified, rectified, and then the Public Health Agency was involved in addressing that.
Okay, so it was one specific event. Did you brief the minister that this event happened?
I was not present at that time, so I can't actually speak to what briefing, but we can take that away.
Okay. Were the 10,000?
Sorry, I just that's an open-ended. Are you going to get back to the committee when you say take it back? Is that you're implying you're going to come back to us with an answer on that if the minister was brief? Because Ms. Jeffrey, I will remind you that you're here representing PHAC, so I know the questions are you, but the committee